People who perform repetitive elbow motions, whether for work or for sport, run the risk of developing the overuse condition known as medial epicondylitis. The cause of medial epicondylitis can stem from a single traumatic injury, but most often occurs gradually from actions that stress the tendon over time. Golfing remains one of the leading causes of medial epicondylitis, giving it the common name of golfer's elbow. Symptoms of golfer's elbow include burning on the inner part of the elbow that can radiate down into the inner forearm, weakened grip strength, difficulty making a fist or moving the forearm without pain, inflammation, tingling, and numbness that can radiate from the elbow to the fingers. To manage golfer's elbow, patients should start with rest, ice, compression, and over-the-counter non-steroidal anti-inflammatories such as Ibuprofen. While most cases of golfer's elbow respond well to conservative treatments, patients should still seek medical attention from an orthopedic specialist if suffering from elbow pain. Orthopedic specialists may prescribe wearing a brace to reduce the tension on the elbow tendons. The treating physician may also recommend stretches to strengthen the forearm and reduce the chances of the condition worsening. If these options fail to relieve the pain, physicians may recommend steroid injections. Specialists may also consider operating if the pain persists for over a year. But luckily, few cases of golfer's elbow reach the point of requiring surgical intervention.